Malaria is a life-threatening disease caused by parasites transmitted through the bites of infected female Anopheles mosquitoes. It is a major global health concern, particularly in tropical and subtropical regions. Let's dive into the symptoms, types, testing, prevention, and treatment of malaria. Malaria symptoms typically appear 10 to 15 days after the bite of an infected mosquito. The most common symptoms include fever, a high fever that comes and goes in cycles, chills, sudden chills and shakes, followed by sweating, fatigue, feeling unusually tired or weak, headache. Intense headaches are common, muscle pain, muscle aches and pain throughout the body, nausea and vomiting. Many people experience gastrointestinal symptoms, and anemia due to the destruction of red blood cells. In severe cases, malaria can lead to organ failure, coma, and even death, making early detection and treatment crucial. There are 5 species of Plasmodium parasites that cause malaria in humans. Plasmodium falciparum, the most dangerous species, responsible for the majority of severe malaria cases and deaths. Plasmodium vivax, the most common species, found in Asia and Latin America, causing less severe malaria, but can lead to relapses. Plasmodium ovale, similar to P. vivax, it can cause relapses. Plasmodium malaria, less common, but can cause chronic malaria. And Plasmodium knowlesi, a rare species found in Southeast Asia and primarily affects monkeys but can infect humans. To confirm malaria, laboratory testing is required. Some common methods include microscopic examination, where a blood smear is examined under a microscope to identify Plasmodium parasites. Rapid diagnostic tests, which detect malaria antigens in the blood and provide quick results. PCR, a molecular test to detect the DNA of the malaria parasite. And antigen and antibody tests, used to identify specific proteins or antibodies related to malaria. Preventing malaria primarily involves reducing mosquito bites. Here are effective measures. Insecticide-treated bed nets. Sleeping under these nets reduces the risk of mosquito bites during the night. Indoor residual spraying. Spraying insecticides on walls and surfaces to kill mosquitoes. Anti-malarial drugs. Travelers to malaria. Endemic areas may take preventive anti-malarial drugs, eliminating mosquito breeding sites. Reducing standing water where mosquitoes breed can lower transmission rates. And use of mosquito repellents. Applying insect repellent on exposed skin helps protect against mosquito bites. Malaria can be treated effectively with anti-malarial medications. The treatment depends on the type of malaria and the severity of the disease. For uncomplicated malaria, oral medications such as artemisinin-based combination therapy are commonly used. ACT is the first-line treatment for Plasmodium falciparum and other species. For severe malaria, hospitalization is often required, with intravenous artesunate being the treatment of choice. Chloroquine is used for treating Plasmodium vivax and Plasmodium ovale infections. Primaquine is administered to prevent relapses of Plasmodium vivax and Plasmodium ovale. In addition to anti-malarial drugs, supportive care like hydration and blood transfusions may be needed for severe cases. Malaria remains a significant global health challenge, but with early diagnosis, proper treatment, and preventive measures, it is possible to reduce its impact. If you're traveling to a malaria endemic area or experiencing symptoms, it's essential to seek medical attention promptly. Together, we can fight malaria and work toward a malaria-free world.